You have chosen to have a Studer pouch Neobladder created. The following video will help you to care for and manage the Studer pouch Neobladder. This is a general guide as each patient is unique. What is a Studer pouch Neobladder? A Studer pouch Neobladder is a type of urinary diversion that will be the new storage area for your urine once the bladder is removed. Having a Studer pouch Neobladder means your new storage area is entirely made of bowel, small intestine. The surgery. Your bladder and a piece of your bowel, small intestine, is removed. The small bowel ends are then reconnected so your body can continue to digest your food normally. The piece of bowel removed will then be positioned inside your body and reshaped into a pouch that will be your new storage area for urine. This is called a Studer pouch or a Neobladder. Your ureters, the tubes from your kidneys, are attached to this new pouch. The new storage area is also connected to your urethra, allowing you to pass urine. The muscle, also known as the sphincter, allowing you to control the flow of urine, is left intact during surgery. Differences you can expect after the surgery. The intestine normally produces mucus in your body. This is a filmy substance that is excreted with the rest of the waste from the intestines. When the intestine becomes a Studer pouch, it will still produce mucus. Mucus will collect in your Studer pouch along with urine. The muscle will be weak at first, but eventually it should allow you to store urine in your Studer pouch until you're ready to pass your urine. If you experience leakage prior to surgery due to a weak muscle, you most likely will continue to experience leakage and will need to work on strengthening your pelvic floor muscles. What happens right after the surgery? You will have 2 catheters placed during surgery. One catheter will go through your abdomen into your Studer pouch. The second catheter will go through the urethra into the Studer pouch. The catheters will drain out any urine in the Studer pouch. You will also likely have 2 stents exiting through your abdomen. Both catheters will be removed after your cystogram, a test used to check that your Studer pouch is working well. This will be done approximately 14 to 21 days after your discharge from the hospital. The 2 stents exiting through your abdomen, these will be removed before you leave the hospital. Your hospital stay length will vary but can be between 5 to 7 days or longer as your urologist deems necessary. Upon hospital discharge, it is important that you continue to care for your Studer pouch after discharge. You will go home with 2 catheters, one through your abdomen and another through urethra, still in place. You will be given some supplies and instructions on how to flush and care for your Studer pouch. Sometimes all the urine comes from just one catheter and the other catheter does not seem to drain anything. This is okay. It is important that at least one catheter is draining urine. These catheters need to continue to be irrigated, fluid pushed in, and aspirated, fluid pulled out, with normal saline. Flush and care for your Studer pouch. Do not remove the catheters. Catheters will be removed after the cystogram. The following is a guideline on how to flush and care for your Studer pouch. Studer pouch care after catheter removal. After your catheters have been removed, care of your Studer pouch will begin. Your Studer pouch will hold a small amount of urine at first and take time to get bigger. During this time, you will need to urinate on the toilet and catheterize yourself after. Insert a tube into your Studer pouch through your urethra. Reason for catheterization is to ensure the Studer pouch is completely emptied and there is no residual urine left in your Studer pouch. Leaving urine in your Studer pouch can lead to infection and the possibility of stone formation due to the absorption of the urine by the Studer pouch. At first, the Studer pouch holds only a small amount of urine, about 150 milliliters. Slowly, the Studer pouch will mature and increase in size, up to 450 milliliters. As it increases in size, you will be able to increase the length of time in between emptying. Following the schedule provided will help you to regain your urinary continence. There are two components in the scheduled care. 1. Scheduled voiding. 2. Scheduled catheterization. Scheduled voiding. The following table is your voiding schedule. We strongly encourage you to follow the schedule, whether you feel you need to void or not. Initially, it is important just to sleep and worry about continence later. Do not deprive yourself of sleep while you should be recovering from surgery. You can use a condom catheter for men or incontinence briefs initially at night for leakage. You may want to avoid fluid intake up to 2 hours prior to bedtime. The more fluids you drink, the more frequently you will have to void during the night. Also, limit alcohol intake prior to bedtime as it acts on the body to produce more urine. Higher consumption of alcohol can also lead to dehydration and in turn cause more mucus buildup. Scheduled catheterization. This algorithm is your catheterization schedule to measure how much urine is remaining in the Studer pouch after you try to empty it. Make sure you record these amounts. After catheterization, always irrigate the Studer pouch with 60 milliliters of normal saline to prevent mucus buildup. Call your physician if you have any of the following: fever greater than 38 degrees Celsius for 2 readings taken 4 hours apart, abdominal or flank pain, blood in urine, sudden pain or bleeding when inserting the catheter, increased urine leakage between catheterizations, inability to insert the catheter, absence of urine when you catheterize, nausea and vomiting.